I'm Dr. Tiina Meder, dermatologist and founder of Meder Skincare brand. And today I'll be speaking on one of the most controversial, most popular, and the most difficult topics, sensitive skin and rosacea, and our approach to the strategy of the sensitive skin and rosacea treatment, which is completely new and based on the science of the last dozen years, including microbiome, including new understanding of the role of nervous system in the sensitive skin and rosacea. So let's start. I will start always with the first slide, with our Meder Beauty ethos, just to remind you that before I started the brand, I was a cosmetic safety expert. I never was a manager. I never get any degree in marketing. I'm zero in marketing. But I'm really good in cosmetic safety. So safety first, and skin health is our real priority in all products which we launch on the market. Also, we are very inclusive because I believe that all women should have a chance to use skincare safely. And my principle, if the product is not safe to put on the skin in pregnant women or in breastfeeding women, it should not be put on the shelf. We all should have this safety level, not only some category of people. And also we should offer to pregnant and breastfeeding women and to everyone safe but efficient skincare solutions. Also, another of our principle, it is the support of the skin microbiome. And since 2009, we started to use probiotics. And now we are using prebiotics, probiotics, metabiotics, postbiotics, whatever, in all of our professional treatments and in all our skincare range. And we are, and me personally, I'm against of aggressive skincare because I just don't believe that you should suffer to get your skin beautiful. You can get your skin healthy with no pain. It just takes smart solutions. It just takes more attention and more confidence in science and in the natural mechanism of healing in your skin. And also I love biohacking. So I am constantly using for different molecular mechanisms of skincare, of all kinds of skin conditions. And when we find one, and you will see in rosacea, we found one very new, we use it and we just hack it. And we just put this new understanding, new scientific understanding in use. So, what is sensitive skin? Sensitive skin is so many things. It's easier to say than we don't know even the name for the sensitive skin. Because look how it's called. Sensitive skin can be called reactive, can be called hyperreactive, can be called intolerant, can be called irritable. You will see all this name in scientific papers. They all mean the same, something going wrong. And we don't actually know because symptoms of the sensitivity of the skin, they are multiple and they're so variable. So you can experience tingling, pricking, heat, burning, sometimes pain, sometimes redness, sometimes itching, whatever you can. And it can be different in different days of your life, in different periods of your life. And it can be triggered literally by everything. Ultraviolet, heat, but also by cold, by wind, by water, by swimming in the sea, by dryness, by literally everything. And I don't even start with chemicals, skincare, sunscreens, food, and a lot of other factors in the human life. And also it can be psychological. Stress is causing skin sensitivity. Hormonal imbalance causes skin sensitivity. Different kind of health conditions can cause the skin sensitivity. So literally everything. Skin can be sensitive in teenagers' age, in the menopause age, because you traveled, because you didn't travel, because you wake up early, because you go to bed and stay to bed physically inactive for a couple of days. So everything can trigger the skin sensitivity. So it's the most difficult thing to diagnose because it is not objective. It is all about emotions. It's all about I don't feel well. And when we're speaking about skin sensitivity, for some reason, we are speaking mostly about the face. But if the skin is really sensitive, it affects the whole body. It affects the hair and scalp and genitals and hands and feet, everything. So, apparently, it is not a condition which manifests on the face because you did something wrong to your face. It manifests in your whole body. So it's linked to the whole body reaction. And this is a portrait of my favorite man in science. That's Professor Laurent Misery from France, from Lyon University. And he is one of the most authoritative scientists in the domain of sensitive skin and rosacea. And his hypothesis about the skin sensitivity based on the interconnections between the skin and the nervous system. And actually, you see it in the biology, because every millimeter of the skin is innerved by millions of nerve fibers, receptors, and other structures from the nerve system. And the nervous system really defines the anatomy of the skin. So it's no skin cells without nervous cells. It's no skin without nervous system. So Professor Laurent Misery, he offered this new vision of the skin. And he proposed to call the skin not the skin itself, but skin, nervous, immune system. It sounds better in French, but still. So it's called SNIC, skin, nervous, immune system. C it's because cutaneous, it's in French. And the whole system, it just defines the skin as a global organ, including interaction and structure from at least 3 systems of our body. And actually after, he added endocrine system as well, because skin has a hormonal activity. So we cannot see the skin as an isolated community of skin cells. We see the skin as a community of skin cells, nervous cells, immune cells, endocrine cells, and the microbiome. So it is complicated, but in this complexity, you will find the key to all skin conditions, skin sensitive included. And also the skin and nervous system, they use absolutely the same language. They communicate with each other using absolutely the same substances. How can be? Is it coincidence? Actually, it is not. And because of the same biochemistry of the language, biochemical signaling, the nervous system controls every primary function of the skin, including differentiation and division of cells. Just take this as an example, circadian rhythms, right? We are living in these circadian circles of 24 hours, day, night, like everything living on our planet Earth. And our cells in skin, they are dividing once a day, just once a day, late evening, early night. That's why they call it beauty sleep, because if you don't go to the bed before midnight, it can really disturb your skin division. And the next day, your skin will not be renewed perfectly. But why it's dividing at this time of the day? Because the structure in our brain, called suprachiasmatic nucleus, sends a stimuli to body clock in our skin cells. It's purely nervous system control. And our skin are differentiating once a day. And differentiation process happen to be in the late night, early morning. So it's not only important to go to bed not too late. It is important to not wake up too early, because you should give your skin cells time to divide and time to differentiate. And who control it? Once again, nervous system. That's not a decision of our skin cells. That's not a decision of endocrine system. It is a nervous system control. Why so? And here's the most amazing thing about the skin. Our skin and nervous system, they are literally the same organ. because it's called ectoderm in the past. In our embryo life, it splits only at week 3 of the embryo development. First 3 life of the human being existence, skin and nervous system, it is the same. It's called ectoderm. But after 3 weeks in the development in womb, it's splitted, and part of this ectoderm, inner part, it grows up like a tree, forming the nervous system with small branch and leaves and everything penetrating into each cells of our body. And external part of ectoderm, it just covering our body, protecting it, becoming skin. But it is still the same. Embryologically, it is the same. So like Professor Meder said once, I was lucky to hear it, in 2000, he been saying skin and brain are embryological siblings, missing each other. And skin is a peripheral, external reflection of the nervous system. And he told them the embryological siblings missing each other their whole life. They exchanging messages the whole life. That's like 2 twin siblings living in distance, but speaking to each other on the phone. So let's see how it affects the skin sensitivity. In our skin, there are a lot of skin structures, skin cells, fibers, and so on. And especially there are many of them in the epidermis. We have tactile discs, we have sensory neurons, we have keratinocytes themselves. They're playing for 2 teams, nervous and skin. We have melanocytes, pigment cells, and they are called skin neurons because they're literally pigmented nervous cells. Langerhans cells, cells of immune system, forming the immune reaction, protective reaction in our skin, also interacting closely with the nervous system, and Merkel cells, and a lot of them. So there are a lot of structure in our skin interacting and forming the reaction of the nervous system. And also that's devil picture. It is a picture of a very interesting structure in our skin, looking like horror movie, right? But there are toll-like receptors, TRP channels. These small channels, looking like these beautiful pictures, they are expressed with an H in keratinocytes, exactly the same are expressed in Merkel cells and in nerve ending. And they are wired to release and depolarize cell membranes, acting via calcium channels. Also, they release all kinds of neurotrophic agents, creating and forming the reaction which nervous system order to have in skin cells. So it can be development of inflammation, but it will be neuroinflammation, which is slightly different. They can develop pigmentation. They can develop calming effect, opposite. So they can do everything with the skin. They're like small kingdom of these TRP channels in the skin. And they can be activated by everything. Spicy food, red wine, cold, heat. Sounds familiar for rosacea, right? And yes, because TRP channel, they're very much involved in the pathogenesis of rosacea and pathogenesis of the skin sensitivity. And when these TRP channels, they are acting healthily, everything is fine because you have right to react to the heat. When you go to sauna, your face and your body becomes red because it is a protective reaction. It's just some vasodilation which helps you to evaporate the water and to decrease your body temperature. It is a thermoregulation. But if you become cold red just after the small glass of the coffee, small mug of the coffee or small glass of the red wine, it is not normal. And it happens when your TRP channels are overexpressed. because of some kind of genetic predisposition or some lifestyle or health factors affected your body at the same time. What kind of factors affect your skin and the body? We have two groups of factors creating the whole picture of the sensitive skin. First, cutaneous factors, and another, they are external factors. I just take the information from the paper written by Professor Warren Misery and just regroup it to make it more visual. So for cutaneous factor, it can be genetic predisposition, which we call atopic predisposition. It can be unbalanced microbiome, surprise, surprise, microbiome here in play, very much in game. Also, disturbed skin barrier. For example, you just use some harsh cleanser. You choose the soap for the daily shower. It can disturb the skin barrier. It can be the factor leading to the skin sensitivity. It can be overreactivity of your nervous system. For example, you are under the stress. So your nervous system is just overwhelmed, and it can lead to the skin sensitivity as well. It can be overexpression of TRPV1 receptors, called toll-like vanilloid receptors of the first type, who are known to be involved in the rosacea pathogenesis. And it can be neurogenic inflammation, reaction to some inflammatory factors. Unfortunately, neurogenic inflammation is well known to be related to hormonal disbalance. So the skin can be neurogenically inflamed in pregnant women, breastfeeding women, in menopausal women, in all kinds of situations when your hormonal balance is changing. But they can be external factor, environment, air pollution, even the noise, because noise is also the pollution. It can lead to the skin sensitivity. And that's why so many people with sensitive skin are living in the megapolises. Statistic of the sensitive skin is very tricky because it looks like the richer you are, better your life is, higher the risk of the skin sensitivity. Because even in different regions of the world, they have found that statistically more people suffering from the sensitive skin in the so-called gold billion people. Why so? One of the factors, it's not only because they or we are spoiled, but maybe it is a factor, who knows. But also because a lot of people, they are living in the very big megapolises, in the big cities, big towns, they're exposed to the air pollution. They're exposed to a lot of preservatives, colorants, especially in the food. They're living under the stress. So all these factors can lead to the skin sensitivity. But also, climate, when it is extreme, it can be the factor and kind of significant factor. Exposure to the ultraviolet, substance use, different kind of skincare, especially skincare, speeding up renewal process in the skin because it disturbs the skin barrier. Skincare affecting the microbiome, so any kind of disinfecting, antibacterial skincare can lead to the skin sensitivity. And everything which is dissolving precious lipids in the skin. So a lot of products for oily skin can be triggering skin sensitivity. And endogenous factor, including not only hormones, stress, but also emotional lives. We are all emotional, and when you produce more of endorphins, happiness hormones, it's better for your skin. If you produce more of stress hormone, cortisol, it can lead to the skin sensitivity. So, a lot of things. And when the skin is overreactive, actually all patients with a sensitive skin demonstrates the increased presence of nervous growth factor in your skin. Do you remember we have this epidermal growth factor, which we are using in the skincare? But there are a lot of growth factors, small peptides, circulating in our body, helping in our body to grow things. Like dermal growth factors, it helps us to grow the dermis. And nervous growth factor, it helps us to regenerate, it helps us to grow the new nervous structures and new nervous fibers. But when it is overexpressed, when the presence of NGF is increased, it's a risk factor, and it really can be the marker of the skin sensitivity. And look, this is very interesting graphics. It's actually sensitive skin in Indian population. What is triggering the skin sensitivity? There are most of people, more than half of people, the trigger for them, it is a heat, warm climate condition, shift of the temperature. So when you are entering the door in some nice office or the shop or anything else, and it is very cold and outdoor was very hot, it is a trigger. Pollution, cold climate conditions, so cold and heat at the same time. Also moist air, dry air, wind, air condition, and water. No rules. Everyone is individual. You pick your poison, actually, or your skin and nervous system pick your poison. And the sensitive skin, we observe also a lot of comorbidity. Comorbidity, it means some illnesses, some other conditions, they manifest more in combination with the sensitive skin. And you see the most of comorbidity, it is in acne. About 20% of people with sensitive skin have acne. So it's clearly the link between acne and skin sensitivity. Also, contact dermatitis, atopic dermatitis, rosacea, but paradoxically, look at this. Rosacea is 3 times less comorbidity with sensitive skin than acne. And we all think like everyone with rosacea has a skin sensitivity. Actually, not. But about 1/5 part of acne population, they have. Also, vitiligo, psoriasis, seborrheic dermatitis, pigmentary and hypopigmentary marks. And another surprise, pigmentation comorbidity with the sensitivity skin is higher than psoriasis. What is funny finding, right? Because it's really break down our stereotypes about sensitivity skin and dermatological condition. And there are a lot of classification of the skin. Another nice table made by myself. I did some historic research because just to show you that on different steps of life, on different steps of scientific development, it was different classification for the skin sensitivity. So don't be afraid to use some large terms because they've been used already and they're all published. So they're all like scientific truths. First one, Japanese classification, Yokota. They have 3 types of skin sensitivity. Unprotected skin, so literally everything about disturbed, impaired skin barrier. Another, inflamed, so all kinds of inflammation and skin sensitivity goes to this class. And another one, neurosensitive, which I call literally everything else. So when you see no inflammation, no skin barrier problem, okay, neurosensitive, just like this. Another classification, Nielsen-Berger, European one. First group, all dermatoses, people with dermatological conditions out of remission. Second group, people with dermatosis but with minimal manifestation of dermatological condition. Group 3, healthy people, but they've had this experience of skin trauma. For example, people after chemical peels or people after laser resurfacement. And finally, fourth group, familiar one, everything else. People who are not included in the previous 3 groups. You see how scientifically precise it is. Yeah, it's all about skin sensitivity. Sometimes I physically feel like researchers will be so desperate and they're like, whatever, let's put in the last group everyone. Classification based on the degree of change, which I like to use because it's really helped to evaluate the dynamic of the treatment. So group first, very sensitive, after we have sensitive skin, slightly sensitive skin, and resistant skin. At least that's no group for everyone else. And you can see, is it doing better or not? And finally, classification based on the factors and triggers. So the skin with severe reaction to all kinds of external factors, the skin with reaction only to something you apply on the skin, so contact dermatitis and contact sensitivity, and skin with reaction to natural factors. So when you react to something in the air, you are in this group. But still, my favorite, it is a Degouy, because I don't see how I can use all the rest. And there are a dozen more classification, and they're all kind of complicated. So sensitivity diagnostic, it is the most important thing. It's like, you know, formula question, sensitive or not? That is the question. How we answer it? First and foremost, we don't have objective instrumental diagnostic of sensitivity of the skin. It is impossible. We just cannot get it in our real practical life. But thanks to Professor Laura Misery, we have sensitivity scale, which I found very useful, and I'm using it in practice for more than 10 years. And this sensitivity scale, SSS10, another SSS14, which is used mostly in dermatology, it really helps to find the skincare solution, to find the therapy solution, and after, in the follow-up, to objectivize how efficient it was. So what should you do? You should ask your patients exactly this question. In the last 3 days, have you noticed any of the following sensations? Please don't forget about 3 days. Because if you ask, did you notice any of the following sensations? Obviously, everyone noticed any of them, at least once in their life. But for us, informative answer, it is about the last 3 days, because we should diagnose the skin condition here and now. And ask to score this sensation from 0, which is not at all, until 10. So yes, I experienced this sensation 72 hours, and it created a lot of discomfort, maybe the pain. So 10 of them. Irritability of the skin, stinging, burning, sensation of heat, tautness, itching, pain, general discomfort, redness, and flushing. If you patients and yourself are speaking different language, you can Google sensitivity scale and to find official translation, which is based on the terminology used by the real people. Because people call redness, you know, everything. So please don't try to translate yourself, just Google it and use translation of the SSS scale. It will be much more helpful. And after everything, it's easy. You do small mouth. If the whole score is up to 20, no worries. Skin is resistant. You don't need to be too careful. You can use high-intensity treatments. You can offer different kinds of skincare solutions, including intense solution, including solutions speeding up renewal process. So you're not very much limited. If the score is 20 to 60, the skin is sensitive. So you should be more careful. If you make a choice to use some high-intensity treatment or intense solution, please be careful. Add mild cleanser, add microbiome-friendly solution, everything which helps to minimize the skin sensitivity and inflammation. If the score is over 60, please be extremely careful. Don't use harsh skincare. Your choice should be sensitive skincare in this situation. One and only. And it will be great if you use Meder. And please do not use intense treatment, including chemical peels, laser resurfacement, radiofrequency, ultrasound, focused ultrasound, all kinds of treatment based on the thermal energy in devices. In this situation, I recommend to use LED therapy, light therapy, microcurrent therapy, and maybe hydrodermabrasion, not something else. And it would be great if you can recommend dermatologist consultation, because it's very often when it is some dermatologist condition hidden behind the sensitivity. And the biochemical situation is really, complicated, because you see how sensitive neurons can be easily activated in our body, in our skin. Actually, everything referring to the barrier function, like all kinds of stimuli, once again, snow, cold, heat, ultraviolet, pollution, detergent, skincare, something else, it can trigger the synthesis of neuromediators, creating this high sensitivity reaction. It's electric stimulation of the nervous influx. It's a release of calcium. And in the same time, what we see, itching, discomfort, pain. Why? Because it makes our mastocytes release substance called histamine. It's a reaction very similar to allergy reaction. So that's why it's red. That's why it is itching. That's why it's inflamed. So, how we work on it? Only thing to add, probably, not only thing, there are a lot of things to add, but anyway, microbiome sensitivity hypothesis. Microbiome is very much involved to the skin nervous reaction, because our bacteria and viruses and fungi and whatever it is in the microbiome, they are present in the superficial layer of the epidermis. Then they are able to interact directly with nociceptors of our skin cells. Noci means pain. With prurireceptors of our skin cells. Pruri means touch. And all kinds of other receptors expressing this, do you remember this goat-like CRP receptors in our skin? And these receptors can be activated, can be expressed via this bacterial cells communication. All commensal beneficial bacteria are known to be so-called anti-inflammatory. So they calm down the sensitivity. For example, lactic bacteria, lactobacillus, and all kinds of lactic microflora, bifidum microflora, and Staphylococcus epidermidis. They are express and release substances which calm down TRP receptors. But pathogenic bacteria like Staphylococcus aureus or overgrown Cutibacterium magnes or some other bacteria, they are activating the overexpression of the TRP receptor, so literally creating the reaction of sensitivity into the skin. And skin microbiota can really influence not only the sensitivity reaction in cells, but also migration of cells and maturation of cells in the skin. And as we recently found, it can trigger pigmentation in skin cells. So microbiota can be responsible, or at least partly responsible, for the skin sensitivity. What should we do about it? Actually, the key for anti-inflammatory microbiome, it is a free water. So if your skin is moisturized, you are in low risk of skin sensitivity, because to thrive, these beneficial bacteria, they need to live next to lake, next to river, next to the sea. It's exactly like human population, right? So they really in need of this source of free water. It's not enough to create the film on the skin surface, like with mineral oil or any kind of rich cream, which just, prevent the water evaporation of the skin, because the water in this situation will be binded. But you need the free movement of the water, the free dynamic of the water in the skin, like the real healthy skin barrier does. So for the microbiota, for the microbiome, and for anti-sensitivity microbiome, you should think about skin moisturizations as well, not only based on the oil-based solution. You should get water-based solution in the intro. So traditional moisturizer, that's a quotation from the paper. Traditional moisturizer bind water to the skin cells, improving the skin hydration, but not the amount of the water. But our formula that I added, I designed them to be considered as a free water skincare. And actually prebiotics help us to create this free water amount on the skin. So what can be used for the neurotherapy of the skin? A lot of things. We address not only keratinocytes, but all other cells, including immune cells, Langerhans cells, and obviously receptors and neuromediators. The names of neuromediators expressed by skin cells, they are substance P, bradykinin, neurotensin, but also dopamine, known from another area of science, endorphins, hormones of happiness, and catecholamine. They are hormones, and they can be adrenaline, noradrenaline. They are also circulating in the skin. And our goal is to reduce the skin sensitivity to these neuromediators and increase the skin sensitivity to hormones of happiness and dopamine. Also, in results, we can get capillaries tightened. We can get relief for dry and itchy skin. We can suppress the release of histamine. And that's what we need to restore this healthy feeling, healthy comfort in the skin. So ingredients we are using, the peptides, like skin essential, calmosensine, largely used in our formulas. The niacinamide, surprise, niacinamide is neuroactive ingredient as well. The panthenol, they are mushroom extract, like Albatreus hominus. I will speak about it later. And Centella asiatica, aloe vera, green tea, chamomile, so traditional plant extract. They're also very active. In conclusion, in this part about the skin sensitivity, I just like to remind that sensitive skin patients, they are difficult patients. In this inner discussion, in skin therapists' work, they very often we discuss these patients like difficult people, but they are difficult because their hopes have been crushed so many times. They are so disappointed. Often their problem doesn't get any kind of professional attention. They seem like something non-important, and even worse, like something delusional. Because their skin looks normal. And when they're starting to speak about itching, discomfort, asking for help, dermatologists can say to them, I don't see any problem. Probably you're just too sensitive. Probably you should sleep better. And so it's just dismissal of the negative effect which skin sensitivity can have on the life quality. So an insufficient attention to this kind of patient leads to the incorrect therapy, to the incorrect skincare prescription. Many times in my professional lives, I've seen people who've been suffering from skin sensitivity and been prescribed very active retinol-based product for the wrinkles treatment, which obviously only worsened their conditions. They couldn't be happy from the results because they feel pain, they feel discomfort. So the choice of the skincare should be suitable and should be based on the sensitivity of the skin at first. And rosacea is the part of the problem. It represents a huge burden, emotional and physical. And in the US, rosacea affects 1 in 10 people and even more. And symptoms appear usually in 30s, 60s, and women are especially affected by rosacea. And actually, rosacea, yes, it is more common in fair-skinned people. But you cannot say that it doesn't exist in dark-skinned people. It was a huge mistake. It was a huge misdiagnosis because until end of 90s, that was the total misconception. Then rosacea, it is Celtic malediction. Only people with first or second phototype by Fitzpatrick are in high risk. Dark-skinned people are in risk of rosacea. They've been not diagnosed because dermatologists couldn't see through the dry skin. So you should be very careful. And if you see the symptoms, think about rosacea. Because a lot of people have been treated from acne only because the rosacea was already in papulopustular stage. And when you treat papulopustular form of rosacea with acne treatment, you will not get results because treatment should be different. And prescription treatment may include antibiotics, metronidazole, erythromycin, azelaic acid, ivermectin, brimonidine. Unfortunately, the level of compliance in rosacea treatment is very low. Why? Because it isn't comfortable. Because it doesn't bring immediate improvement in the skin. And because of it, it's so important to use skincare from the day one after you diagnose patients with this condition. Skincare does not replace rosacea treatment, but skincare helps people to get real treatment, real dermatological treatment, to stay compliant with the treatment. And most importantly, skincare helps people to stay in remission because we cannot prevent rosacea. It's genetically predetermined. We cannot cure rosacea for life, but we can get remission of rosacea, and we can control remission of rosacea for many years. If your patient is using real medically grade rosacea skincare, and don't experiment with different kind of trendy skincare probably. And obviously you should be careful about lifestyle factors as well. Unfortunately, some kinds of therapies are not avoidable by insurance. As I know, the laser therapy is not avoidable to everyone and not affordable to everyone. Unfortunately, in the UK, it is the same problem like in many of European countries. And also the info on the patient sites. I'm sorry to say, but it is so old-fashioned. It should be forgotten. What kind of information is useful for the patient? When you just the information, avoid cleanser contain acetone. Really? It's a real information which I took from the patient info rosacea website. Acetone. We are living in the 21st century. I really hope there are no cleanser with acetone anymore. Let's discuss about real help to people, because people addresses this patient website. So I really hope they will be renewed one day. And rosacea burden is really undermined because, look at this, it was great research. Rosacea beyond the visible, I really made by Galderma. And in the second part of this research, it is how COVID restrictions and COVID management affected people with rosacea. So I really recommend to find it, to read it. It is an open access in Google. And you see, 15% of people with rosacea avoid swimming. 21% of people with rosacea avoid any makeup, cosmetics, because it's too irritating. People say that when they have outbreaks, it affects their mood, it affects their social life. And even what shocked me most of all, 2 more rosacea sufferers have such a high impact on their life by rosacea. They're willing to trade a year or more of their life to have cure. That's how desperate they are. So we should help these people, and we can do it. And that's why we created this home skincare and professional skincare for sensitive skin and rosacea. As you can see, it's not huge. There are 5 products you should get on your shelf to help this category of patients. And they are multi-awarded. I'm very proud about it. We've got this Marie Claire award. Our treatments are highly commended for rosacea treatment. Our mask been called best masks for rosacea and sensitive skin patients. We have best sensitive skin day moisturizer for our special cream for sensitive skin people. So what you should have. 3 products are relatively non-specific for rosacea. They are designed for sensitive skin. So if you have a patient with a sensitive skin, with no redness flushes or any kind of dermatological symptoms, 3 white bottle. Netopax cleanser for sensitive skin. Prebiotics containing, microbiome friendly, restoring anti-sensitive skin microbiome, anti-inflammatory microbiome in the skin. Sensitive skin serum, Soanapax, based on Centella asiatica, which is suppressing the release of all kinds of neuromediators, creating the sensitivity in the skin. And another white bottle, Salvaderm cream for sensitive skin. Ideal moisturizer for sensitive skin, not too lightweight, not too heavy, based on the skin identical, based on macadamia oil and ceramides, containing prebiotics and probiotics. So it's really restoring the skin barrier and calm down the skin immediately in the first days of use. If your patient experiencing rosacea symptoms, if he or she are diagnosed with rosacea, Redapax concentrate for the daily use for at least 5 weeks. Better to continue to use Redapax concentrate. I always recommend to use it twice a day in the phase of active treatment and after, just to keep it and to use in the morning or every second day to keep your skin under control. And Redapax calming redness mask for weekly use, and you will be fine. Professional skincare for rosacea. Redapax treatment, which you can offer in your treatment room, in your clinic. It is one of our most best-selling treatments. When sometimes when we are out of this treatment in stock, it is a tragedy for clinics. So it's the most difficult thing for us as a brand to manage, because it's very popular and it's become more and more popular, maybe because the sensitivity is such a big thing now. And so you can offer the treatment once a week for 5 weeks course, but you can also just offer the treatment once a month or even once a quarter for your patients with rosacea and sensitive skin. So what are inside of this product? It's the cleanser and the serum. So you have plant extract, Centella asiatica and Malva sylvestris. You have prebiotic bio E. coli. And this is a duo of product to use day and night for everyone who has a sensitive skin scale score more than 20. Please stay with this cleanser and this serum. Redapax concentrate active serum based on the northern truffle extract. It is a key ingredient of this product. Now I will show how it works, but also it contains prebiotics and probiotics and the Degouy extract, it's a Mexican chestnut, full of natural prebiotic and naturally calming substances. Key ingredient of the Redapax concentrate I am extremely proud about, because it is a northern truffle extract and I love mushroom. The scientific name of the northern truffle is Albatross ovinus. It looks like this nice mushroom on the picture. This mushroom was used in the traditional folk medicine of Viking in Norway, like thousands of years ago. They used it as a topical painkiller. And the first idea of the modern cosmetic chemistry was to use northern truffle as a painkiller to create this natural alternative to amla. But apparently Vikings been feeling pain a little bit differently than modern women and men, so it didn't work perfectly as a killer. It just a little bit calmed down the pain reaction. But as the same TRPV1 receptors are involved in pain and in redness, it was found be able to bind these redness receptors very efficiently. So rosacea patients demonstrate overexpression of TRPV1 receptors and the keratinocytes in their skin, and actually the receptors react to lifestyle factors, to some kind of contact triggers or whatever it is, including ultraviolet, Actually, rosacea patients, they're extremely sensitive to the ultraviolet. For 80% of people, ultraviolet, it is a trigger because they have a faulty antioxidant system in their skin. The overexpression of these receptors lead to the trouble in the antioxidant protection of the skin. So they form these free radicals easier than people with no rosacea predetermination. And in mushroom, they found two unique substances called grifulin and neogrifulin. And this grifulin and neogrifulin, they are able to inhibit and suppress, downgrade the expression of exactly these redness receptors in the skin. And they are able to do it after the first application. And it is a beauty of this ingredient. So it's proved in vivo, it is proven in vitro, and we are using exactly recommended concentration, 3% of this mushroom extract, to block the receptors on the skin. It is not about the capillary, it is about the nervous system. Another key ingredient, it is a Symbiotics EcoSkin, also the whole text is an article, so you can Google it, you can read it, it's really pleasant reading. And you see we are using here probiotic bacteria, lactobacillus, acidophilus, and casein. And we are using here Polymnia centrifolia extract, which is Yakun, and BioE. coli prebiotics. They have this synergy with similar properties to interact with keratinocytes and once again interact with its pain and redness receptors. So they are enhancing the anti-inflammatory response, calm down the skin, and restore this free water amount and the natural skin protection of the skin. Biochemically, it's kind of complicated because it involves different kinds of gut biochemical substances such as kallikrein and lactones and a lot of new active substances as ingredients which are just inactivating inflammatory mediators in the skin. But it works really well. And in people with no problem of skin sensitivity, these microorganisms, these bacteria, are really highly presented in their healthy microbiome. And another product, it is a Redopax mask, which is how you can use on the picture. It's perfectly natural, right? We have chamomile, we have centella, we have marigold here, but also we have Japanese sake, which is the source of the probiotic, living probiotic culture, yeast from the biofermented rice. So it is a sake extract which found to be extremely useful for sensitive skin and for skin with rosacea. It calms down the skin immediately, once again, restoring free water amount, restoring the healthy anti-inflammatory microbiome, and centella, marigold, panthenol, peptide skin sensor. You remember I mentioned them when I've been speaking about inactivation of inflammatory neuromediators, sensitivity neuromediators. So we are using the whole collection of them to have synergetic action, to calm down and to decrease this substance P in the skin and bradykinin in the skin and all different complicated chemical names, which is our body is using to create a problem for our nervous system. And you finalize the daily care with a probiotic moisturizer, macadamia, ceramides, hyaluronic acid, prebiotic aquaxyl from xylitol, which suppress the growth of malassezia fungi on the skin, Pityrosporum ovale. Why it's so important? Because malassezia creates flaking of the skin, and flaking is very uncomfortable, and it's one of the possible sensitivity skin symptoms as well. BioE. coli prebiotic, panthenol, like we use in the mask, and the algae complex to get algae proteins and get algae amino acid to restore the barrier in full. because when you have proteins and ceramides and fatty acid from the macadamia oil, you can really reintegrate this barrier. And how you pick up right patients? Look at this picture. They are relatively random picture from different sources. And in all of these situations, you can recommend and prescribe Meder skincare. 3 products for this girl, probably. 5 products for these people. And you will be fine. In 5-10 weeks, you can get long-lasting results, which should be easy to control with the regular use of the daily skincare. Netapax cleanser, Sonapax serum, Salvaderm cream, and in case when you see the papulopustular form of rosacea, it's not severe. It can be controlled by the regular use of the skincare. You offer Redopax concentrate on the daily basis as well, and Redopax mask as weekly care. Consistency is the key, and you can get success with all these people. But if you see the situation like this, please remember, the skincare, it's not almighty. It can be the part of the treatment. It should be the part of the treatment because it will help to get the dermatological treatment more successful. But there's a clinical form of rosacea, erythematous form, apparently persisting for many years. Severe papulopustular form of rosacea, which should be treated dermatologically, as well as patients should get the proper skincare designed for rosacea. Rhinophyma. It is possible to use skincare, but you will not eliminate the redness here because it is the 3rd step of rosacea. And obviously, the ocular form of rosacea, it should be treated by ophthalmologist. And I've seen many cases in my professional life when skincare therapists, they are offering eye care creams. They're offering some sensitive skin cleanser for this situation. It is good, but these patients should see ophthalmologist and dermatologist. But we have great results in this clinical form of rosacea. Just look at this. That's a 5 weeks treatment. Thank you for Lene Berg from Norway. You can see the redness is gone. The result is a complete success with no medication. Or this treatment also 5 weeks. The picture was taken in the winter time, outdoor. And they asked the patient to stay for 10 minutes outdoor. It was -20. You can see the snow here. But his skin wasn't reddening even in this extreme temperature condition because receptors are binded. If the receptors are binded, your skin will not be reddening. It is a key. If your microbiome is good, if your skin is moisturized, if your receptors are binded, you are gold. You have results. And also a couple of other clinical cases. Belgium, clinical form of rosacea, papulopustular rosacea, great results. And from Riga, Latvia, atopic dermatitis, perioral dermatitis, also can be treated with prebiotics, probiotics, and receptors binding mushrooms. It sounds a little bit paradoxical, but it is still possible. And if you're looking for some nice reading, we are happy to send you this slide. So when you're bored, you can find one or other article and to read it for your pleasure. And thank you very much for your attention. If you have any question, please send it to your distributor's office, to your trainer. And if they cannot answer them, they will ask me and I will help. Thank you.